my sister, who's a hospice nurse back in Chicago, and she's online right now as well, introduced me to some YouTube videos by Dr. Suneel Dhand. And I said, this is really interesting stuff because more of the medical community's hopping on board when it comes to our health. Well, he's my guest today. He's an internal medicine physician specializing in lifestyle medicine and metabolic health. He was born in London. He trained at Cardiff University and then completed his residency training in Baltimore, Maryland. Dr. Dhand entered clinical practice and quickly realized the enormous impact of lifestyle-related disease on health. This led him to writing, blogging, and making social media content on lifestyle medicine, metabolic health, and living a drug-free life. He's the author of 3 well-being books. Over the course of the pandemic, Dr. Dhand also started making content on the failures of the medical profession. And much of his work now focuses on improving the healthcare system and medical education. Dr. Dhand, welcome to the show.
Thank you. It's a pleasure to be with you. Appreciate that introduction.
I love that voice. I spent 4 years in London. In fact, I won the Professional Mr. Universe there in 1986. But great place, great people. Initially, my sister sent me your YouTube video on blood pressure. Then you had a new one to come out yesterday. And Jim McMillan, who's my show producer, and my sister sent me that one. And that literally is about, RFK Jr. He stirred up the hornet's nest about his comments on the youth health crisis. So if we can talk about that, because your YouTube video is really interesting. This is what I've been preaching now since the 1990s. And I used to be called the head case.
Wow.
It's been that long. I'm 70. And finally, people are coming around to my ideas of food intake, the type of food you eat, the activity, all that stuff. So could you elaborate more on what your comments in regards to what RFK Jr. had said with kids?
Yes, absolutely. So this gets to a core of what I believe is the number one issue facing the country at the moment. As you mentioned in that introduction, I'm a physician who primarily focuses on metabolic health and lifestyle medicine because we've known for thousands of years, going back to Hippocrates, that our health is really very much based on our lifestyle, particularly what we eat. And over the last 20 years, I feel like the world has gone absolutely nuts, and the medical establishment, from a time where they used to preach common sense, has also gone completely nuts and become very political. And this is reflected in the number one issue facing this country, and I don't think enough people have realized this, and that is the catastrophic health situation in young people. And RFK Jr. was spot on when he spoke this week about looking around. And this doesn't take a genius.
Yeah.
I mean, you said you've been around for a long time. When you were growing up, it was very rare to see an overweight young person.
Mm-hmm.
And now, look around at what has happened, something very strange and absolutely unprecedented has happened over the last 10 years, particularly since the start of the pandemic. It was already heading in the wrong direction, but it is absolutely abysmal. We have an almost 50% rate of prediabetes now in adolescents, soaring rates of type 2 diabetes. Fatty liver disease is widespread among teenagers and people in their 20s. And why this is such a problem, give it, and again, I don't want to sound like some sort of doomsday merchant. I'm actually quite an optimistic person, but this is awful. Give it 10 more years. All these youngsters who are riddled with disease, inflammatory illness as a result of being so out of shape are going to get type 2 diabetes. They're going to start getting heart disease. They are going to get a whole host of other inflammatory illnesses. And we sadly are only seeing the tip of the iceberg. And what RFK is rightly talking about is that this is a catastrophe. We can't think, as the medical establishment does, that the answer is to medicate people. It's insane. The amount of medicines, prescriptions that are being given to teenagers and people in their 20s, what on earth is going on?
Mm-hmm.
And it makes me tear my hair out as a doctor, because the solution to this is very much getting back to root cause issues, and we need a huge cultural change in this country as well. And we have to ask ourselves, why are young people who are supposed to be at the prime of their lives Whereas 20, 30, 40 years ago, this was a group of people that really wanted to be healthy and stay in shape. And now they have completely let go of their health. And I want to be clear here, because a lot of factions in the Make America Healthy Again movement are kind of pinning the blame on external circumstances like food corporations, like the environment. Yes, I agree, they come into it. But the number one thing in determining somebody's health is their own desire to be healthy. And why have so many young people given up? What's going mentally with them, with their mental health? And there's a spiritual crisis.
Yes.
So I covered a lot there. I'll stop talking and let you ask some questions. But catastrophe is not a strong enough word for what this country is about to face, and it could seriously bring down the entire nation. I do not think people realize this right now.
Yeah, we'll have an economic collapse. Once these young people become adults, okay, the amount of medications they're taking now will greatly increase. They'll be non-functional. They can't contribute to society in general. So we'll have an economic collapse. We cannot support that kind of system. And all this stuff starts at home. We have lazy, I hate to say this, lazy parents.
No, say it. It needs
they're
to
lazy
be said.
parents
You need to be honest.
who don't want to prepare meals for their kids. So they'll stick it, they're a little baby, they'll stick them basically in a high chair and throw Fruit Loops in front of them. I've seen this happen. Or they'll feed them junk food because it's easy to do. They'll take them through to the Mickey D's and give them, a Happy Meal. All that kind of junk, and it's making our kids sick and fat, and you and I are going to pay the price for it because there'll be nobody left to support our Social Security system and take care of the old people. That's it. It's that simple. And when it comes to activity, exercise in general, I'm a 70-year-old man, and I'm more fit than a 25-year-old. It's that simple. So we need to be better get back to the basics, start in the schools, start in the homes, and we need to start telling the truth. And that starts with the medical community as well as the school system. And they need to get up in front of the American people, our politicians, and tell the truth. They're not doing it. It's politically incorrect to say, you're lazy, you're fat, get your butt off the couch and start moving around. Sorry I said that much.
No, you can. And of course, I agree with you. And there's ways to say that in a very diplomatic way. But we have to make people take ownership.
Yeah.
And these parents that are making their kids overweight, it borders on abuse. Let's be honest.
Yeah.
How does an 8-year-old or 9-year-old become morbidly obese? Like, that is on the parents. And this is so widespread. And I'm telling you, it is getting worse every single year. And I'm sure our listeners who are logical thinkers, probably that's why they tune in, can see this too. This would have been unthinkable even 30 or 40 years ago. I'm in a low obesity state in the Northeast, and I'm shocked with what I see. Heaven forbid what this is like in other parts of the country.
Yeah, I have family members. I have a nephew who weighs in excess of 300 pounds, and he's in his mid-20s. And he's had this weight issue since he's been a kid, but it's fed to him by a parent. And it creates a lot of family conflict when it's brought up. So it's terrible, but it has to be done. Someone has to do it, and it needs to start at the top. And that means the doctors in the doctor's office don't be politically correct with your patients when they come and say, "What are you doing to yourself? Get your act together."
Well, this was the thing. 50 years ago, this going back even before I was born, I think doctors were very honest in America and the UK, and that's completely gone. Something really rotten has happened with the culture. People don't want to tell the truth. And to some people, and I don't mean to make this political, but let's be honest, to somebody who's woke, it's a bigger crime to offend somebody than it is to see them die of diabetes.
You got that right.
And that's the crux of the problem. Feelings overrule people's health.
Okay, we're going to push on hold. We have to take a break, okay? Good Life is Last Year, Dr. Fitness. That's me. My guest today is Dr. Suneel Dhand, who's an internal medicine physician specializing in lifestyle medicine and metabolic health. And also I've got my good friend, my show producer, Jim McMillan, in the studio with me too, Dr. Dhand. And he has a question for you.
So, Dr. Dhand,
sure.
I've been following you for quite some time, and you haven't done this in a while, but one of the things that really attracted me paying attention to what you were saying is you would do your hospital rounds, and you would come down during a break or at a lunch or at the end of the day and sit in your car and talk to the camera, and I could just see how frustrated we were knowing that pretty much everybody was in the hospital were there because of what they were eating. Can you speak to that a little bit about your experiences and coming down to the car? It's just fascinating, when I watch you do that.
Okay, yeah, absolutely. Well, firstly, thank you for watching me, and you've hit the nail on the head there. I had recorded a lot of videos about what I was experiencing during the day, which is getting exponentially worse by the year. So I would say when I first started clinical practice, probably about 20 to 30% of everything I was seeing as a hospital doctor was lifestyle related. So it was related to people being obese, having diabetes with all of the consequences, heart disease, suffering gastrointestinal problems. That percentage goes up year by year. Now I'd say it's closer to 80 to 90% of everything I see is related to lifestyle. And what's even more concerning now with our current pharmaceutical mantra, I'm seeing a lot of issues related to side effects and adverse reactions of medication. Mm-hmm. People are coming into hospital. Semaglutide, Ozempic would be a classic example. I think if you actually had most doctors across the country being honest about this, hospitals are being flooded with patients who are having issues related to use of that. Use of that is going up. So yes, I finish my day and I think, wow, I went to medical school with that good old-fashioned notion of a doctor in my head who somebody is sick, you fix them, you give them a short prescription and wave goodbye, and then they get better. But now the reality is that most people are unfortunately eating themselves to death. Mm-hmm. And we have these patients who are morbidly obese. And again, I'm not attacking the patient. I'm telling the truth that they are stuck in these habits for whatever reason. They're getting so many medical conditions, and the medical profession is perpetuating the situation by thinking that the answer is to just pile more medicines and injections onto these people. And they keep getting sicker. Now we're seeing life expectancy go down in the United States. As I mentioned in the first segment, catastrophe is not even a big enough word, and eventually the whole system is going to implode.
Well, if you create a market for your product, you make more money. And this is what they've done when it comes to pharmaceuticals. They've created a market using food to do it, to get people on more drugs, and it's working because people are falling right into the trap. Look at your GLP-1 medications. Everybody wants to take them now. They don't care what the side effects are. When all it does is makes you eat less. Okay, well, why can't you do that on your own? Get up and move around, exercise.
It paralyzes the stomach. Yeah, it paralyzes your stomach and mucks around with your hormones.
You got that right, absolutely. So, if you were in charge of the world, what would you suggest we do?
Great question. So the very first thing I would do is I would pin more on the medical profession.
Okay.
Now, yes, of course, people are stuck in their habits and we've had a cultural rot, but people do listen to what doctors say. I mean, think what happened during the pandemic. Doctors, basically nothing you saw anywhere in the world, all of that craziness would have happened without the blessing of the medical profession, because where else were governments getting their advice from? Everything you saw was ticked off by the medical profession. And doctors made people lock down over a virus which was barely going to hurt most people beyond some sniffles. That's just the truth. Most people were asymptomatic. Of course, some people were affected, but doctors made entire nations lock down. So I think the medical profession, if it actually got its act together, and if I was in charge, I would say, as doctors, you absolutely have to put metabolic health first, and you have to emphasize that at every interaction, and you have to be re-educated that drugs are only a last resort, and people will listen if enough doctors were pushing that message. Let me give you an example. If doctors came out tomorrow and issued a nationwide statement and said that people, and they'd say it in more diplomatic terms, the country is eating itself to death, people should be very careful, cut back on sugar, think about your portions, get outside, get exercising. If the medical profession actually kept saying that, a huge percentage of people would do it. People do listen to doctors. Some people won't, but a lot will listen, and it would lead a big cultural revolution. So, yes, I would make it more difficult for food corporations or to sell bad food and fast food, etc. But I don't think that that's going to be realistically the answer. The answer is to have the medical profession pushing this really hard.
Yeah, so if it came from the bully pulpit, they'd listen more, but they're not. The doctors aren't doing that. Go to any of your big hospitals, like here we have Banner Health, one of the top 10 cardiovascular hospitals in the country. Go to the floor and see what they're feeding their patients. All they worry about is the salt intake. They don't worry about the processed carbohydrates, the amount of carbohydrates they eat, Cheerios for breakfast and hash browns, orange juice. That's the worst thing these people could be consuming because that raises their blood sugar levels. Here we go. There goes the blood pressure.
Exactly, and they give oncology patients, it's well known. People who have cancer and have treatment, they flood them with candies and chocolates. It's horrible. What on earth are they thinking?
Absolutely. Now, if someone wants to get a hold of you, can they do that?
Yeah, absolutely. So I have a website, www.drsuneeldhand.com, and that's got links to all of my work, my channels, social media channels, my health programs. I've got a fat loss, insulin resistance, natural reversal program. But the main way to find me is via my website, put in my name, and I have lots of social media channels, mainly YouTube and Twitter.
Okay, cool. Now, we got a few minutes left before we have to let you go. Talk about your YouTube video on blood pressure.
Yes, so blood pressure, obviously, it's a universal diagnosis. Over 50% of adults have high blood pressure, and what is not taught enough is that blood pressure is mainly a function of what we call insulin resistance. Mm-hmm. So insulin resistance is a true pandemic. Basically, as people put on weight, they become more insulin resistant. I've got lots of videos explaining this and how it happens. But in a nutshell, if anybody has high blood pressure, for the vast majority of people, that can be reversed with lifestyle within a few weeks. And medications can fix the number, but the upstream problem will still be there. All of the inflammation, insulin resistance, what we call oxidative stress, will do that. So if you set about some sensible lifestyle measures, and I know it's tough, I'm not saying it's easy, change is hard, but change is far better than a lifetime of medicines and more complications. Basically, it would focus on a real food diet, focusing on sensible portions, cutting back on the processed foods, the sugars, the refined carbs, optimizing protein, antioxidants, introduce, by all means, time-restricted eating or intermittent fasting. Yes. That would be great. And ramp up your activity levels. Do some muscle strengthening, walk more, whole host of sensible things anybody can start doing. And within weeks, I've seen people bring their blood pressure down and not need medicines anymore. But it hinges on that weight loss and getting yourself in better shape.
Yeah, man, I've been preaching this for a long time. I basically intermittent fast 5 to 6 days a week. I have 2 meals a day, and I'm highly active. I train adults, older people who have problems, get them physically fit.
Oh, fantastic.
We use a physical fitness program we call PHA. You're using resistance in a manner that's cardiovascular. You move around the body, upper to lower body without resting, elevates heart rate, and you're done in about 25, 30 minutes maximum. You've got the strengthening, the toning, you've got the cardiovascular benefits, and you've got the time where it's basically minimal that you have to spend doing it. As far as the eating, I follow a low-carbohydrate diet, 2 meals a day, and I have no energy problems, and I'm 70 years of age. So if a person would sit down and really look at their lifestyle and make these changes, they find that down the road, in a short period of time, they feel better, they look better, it cuts down their medication needs. You know what? They'll live a more enjoyable, longer life. And that's what counts.
Exactly. Yeah, I wish more were like you. That was great advice there. You should actually be the doctor telling people, because what you said was perfect. And I want to also really stress to everybody out there, this is not just a superficial issue about looking good. This is about reducing inflammation, and there is a massive link with mental health as well. You get yourself in better shape and basically treat your body like gold, you will feel $1 million. You'll be thinking more clearly. You will be more productive. You'll be happier. And don't underestimate how being stuck in a bad cycle is going to just make you depressed, and then everything is a downward spiral from there. But it does not have to be that way. Do not fall for toxic modern mainstream culture and get stuck and then be a recurrent customer. That is what I would say to anybody out there. You can resist, and you can make a better life for yourself and your family.
You need to come to Arizona. If you get out here, you let me know. We'll have
I love Arizona.
Mostly in the wintertime. Okay, Doc, I'm going to let you go, okay? Thanks for joining us today.
I appreciate that. Thank you for having me.
I'm going to give your website out when we're done here, okay? Have a great weekend. Bye now.